Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Today I'm joined by Dr. Gracelyn Cruden, a research scientist at Chestnut Health System's Lighthouse Institute Oregon group. Her research leverages science, decision science, and implementation science to develop tools, processes, and partnerships to implement evidence-informed programs and policies. Gracelyn joins me today from Eugene, Oregon. Hey, Gracelyn, how are you?
Hey Charles, I'm great. Thanks. Thanks for having me.
I was going over your LinkedIn page, and it says in 2019 you got your PhD from the University of North Carolina in decision science, which begs the question, what is decision science?
Yeah, it's a great question. I got it just yesterday, actually, from someone in one of our participants in a study we're running. But yeah, so my program was in the Department of Health Policy and Management, and then my minor was in decision science. And so the way that it was primarily defined in my department, at least, was focus on cost effectiveness analysis, cost benefit analysis, those kinds of things, and that's, in the health services research field, I think that's what most people think of when they think of decision science. But my focus is more so really on the theories and the group processes and tools that help people make decisions. So I try to really understand why do people make the decisions they do, particularly when they're making decisions on behalf of others, like, if you're a policymaker. So a lot of decision science work too comes from economics and psychology literature that's focused on maybe individual decision making around like patient decision aids, for example. So how is a patient having a conversation with their physician about what type of medical care they want? Or it's stuff around, economics around, how do we decide what to purchase or what job to take? And so the type of decision science that I do is focused more on how to like a group of people make a decision. So again, like some policymakers in a service system or Congress, for example. And then how do they decide, what to do?
Well, that might be very helpful given what's going on in Washington, D.C. right now, but that's probably asking a little too much of you and the discipline of decision science. It seems to me, going through that and cutting your teeth in that kind of work, that kind of research, a lot of role playing. How do you go about this?
Oh, it's a great question. So, I end up saying that a lot of my work then ends up combining both tools, so like a concrete thing to react to for decision makers to use, with the social process around decision making. And so, what I mean by that is, for example, then in one project, then I do a method called multi-criteria decision analysis. And that's called a socio-technical approach, but that all that means is there's a social aspect of decision making when you're making a decision with a group of people. So you're not only kind of having to decide what you think, but how you're going to align what you think with other folks so you can move forward with the decision. And then the technical aspect, so a tool. So in that project, for example, MCDA or multi-criteria decision analysis is basically a fancy rubric. So think about when you're in school and you're looking at your syllabus and how much your final exam is worth and your homework and all that other stuff. Similar idea then where people they try to understand what's really important to us, what are the things that really matter, how much does that thing matter to us? So whether it's, how expensive an option is, or how much evidence there is behind it, or who is supported by that option. Um, and then you weigh all that a little differently to make a decision. And then I also
Right.
develop and group interventions then for the group to have a discussion based on what the tools or kind of artifacts out in the world are helping them think through. So I use a
So
variety.
it's to some extent, do you have like a range of off-the-shelf models, if you will, or almost like ready-made decision trees? Say, for instance, you're in a group
Mhm.
situation and you need to figure out how to arrive at consensus.
Mm-hmm. Yeah, I love that you brought up consensus. It's a fun thing to talk about as a decision scientist. So we can talk about the theory and frameworks behind that. So I don't have ready-made decision trees that I use. Decision trees are certainly a thing I'm trained in. I've used to look at things, for example, of, what if we were to increase depression screening in primary care for youth and adolescents? Like how many more youth would we expect to have identified depression and things like that. So thinking about flow and cost in that sense. In terms of my off-the-shelf stuff, I have a tool then that's a multi-criteria decision analysis tool that we call the ORCA tool. So optimizing responses for collaborative assessments then that has been co-developed with individuals who policymakers, service system leaders over the years, starting in my dissertation and now in my career development award, where we've developed 18 criteria that we have found, based on the literature and in quite a few qualitative interviews and user-centered design sessions that they say are important to how they think about implementing something, what intervention they think is the right fit for their context. And that is an online tool then that we're developing and testing. And then also testing a group process then for, okay, here's what the tool told you might be the best fit for your context. You told us that it fits your criteria in a way that really matters to you. But then, the group has to make a decision about that. And the way that I think about consensus is that those group processes and these tools are meant to help bring everyone along so that it's true consensus about what the right action might be and that we all have the same mental models, how we think the world works, that we've developed that together over time by using these tools and these social processes instead of it just being compromise, which is often what mostly it feels like, where people are like, fine, I'll go along with whatever the rest of the group's decision is because I just want to make a decision, move forward, or we've run out of time, or so and so had the loudest voice in the room and I don't want to upset them. So all of the methods I choose are designed and the methods I test are meant to explicitly test, do people feel like they had a good decision process? Do they feel like the decision is one that they feel good about? Because we know from kind of more laboratory-based studies, like with psych students and such, that if people feel good about the decision process, they're more likely to stay committed to implementing it and supporting it. So that's obviously what we want, right? When we're thinking about delivering interventions in the community, policy interventions that, people are not just willing to pass the policy or pass in their organization or in their community, but that they're going to keep giving the resources to help it be
Right.
successful.
Right. It feels like your input, you've been listened to, you got some skin in the game. So you're
Exactly.
more apt to see it through. This tool, at what point, at what stage of development, and does it incorporate any kind of AI, any large language
Yeah.
stuff?
No AI or large language in there. That we are in the final phases of getting it into an online version then. We're running it right now through R Shiny. So that's like a way to run apps that are developed in the R statistical programming language. And we've done the user testing then in terms of, yeah, the layout and how it looks like, doing some final refinements though, based on the last round of participant feedback, because we're hoping to test it in a clinical trial in the next few months, actually. And the exciting part about it being online is that you can see what others in your decision-making group are saying, their responses in real time. So we used to have it just like in an Excel when I didn't have any money as a grad student. But the exciting part about having it online is that you make your own assessments of things, and that's best practice in decision making. So for those of you out there who are trying to learn how to make better decisions in your groups, it's best to have everyone reflect on what their perspective is individually and then come together as a group. And so this tool shows you what your priorities are. So those criteria in terms of what matters for an intervention to you and how your evaluation of the intervention compares to everyone else in your group. So you can see, oh, we're actually closer together than we thought. Oh, we're farther apart. But the other really cool thing about it is
So it's able to actually visualize that, show that in a
yeah,
visualize.
yep, we
Cool.
have different tables and graphs and images that we do to help people. Everyone's brains works differently. So we show it in a couple different ways depending on how your brain works. And then it can be really helpful then to break a decision down into parts like that. And so instead of just saying, I think we should do this intervention or I think we should do that intervention, it helps people understand, oh, well, this is the part where we're actually kind of maybe evaluating that option a little differently. That's where we need to focus our discussion so that hopefully you're not talking past each other as much. And what's really cool about that is that we see, when people break their decision down like that, they're more likely to make a different decision than if they were just to make a gut reaction of like, this will be my first, second, and third choice. That's consistent in the literature and what we've seen in our studies as well. And again, makes people feel better about the decision when they're like, oh, now I know why that's the intervention I want to go with.
Yeah, exactly. Oh, that's great. That's a cool project. Might have to
Thanks.
have you back on once you're ready to launch that and talk about it.
Happy to.
Um, Gracelyn, you were recently involved in an online symposium that posed the question, what do we mean by evidence? So let me ask you, what do you mean by evidence?
Oh, I love this question. This is one of my kind of passion side topics, I guess. So, as an implementation scientist, one of our tagline is basically we try to get evidence into practice, or into the real world of saying we're trying to reduce the gap between things that we've tested in scientific studies that actually make it into practice. There's a small proportion of kind of what has been tested that works actually makes it into the clinics that you see, your public health department, hospitals, et cetera. And I know you had Dr. Saldana on, and she's one of the leaders in implementation science, so great one to listen to as well. But I specifically talk about, or I got really excited in terms of how evidence is defined and that kind of gap with the real world when actually in my dissertation we were working on that tool I was just talking about. And I was talking to, yeah, public health department leaders, social service agency leaders, state level legislators. And they were like, yeah, it's really great to have evidence and, scientific evidence that's out there. And that should be the gold standard in what we do. But we also really need to be able to innovate. And we also really need to be able to do what works for our community. And I was really intrigued that people thought that there was this like dichotomy between, what works and evidence and versus the idea of innovation and, what works for their context. Because in science, the idea should be that we're innovating, right? We're figuring out what works, we're advancing, we're moving forward. But the people who were supposed to be using science and evidence on the ground thought that those were different things. And that's one of the cool things that I like about implementation science is it lets you kind of really innovate and kind of push the science forward in a practical way then that responds to the real world context and what people need. And so I think evidence can include the different ways that we've generated evidence through scientific studies in a variety of methods. So not just randomized controlled trials or not just individual level randomized controlled trials. There's a lot of different study designs that can have really good rigor in terms of the conclusions you can make and how you're generating the evidence base. But the reason I say things are evidence informed, that is kind of the work that I do, is I think it's really important to acknowledge that evidence can include, local expertise, so the people who know what their community needs, what they've been observing that we couldn't test in a research trial for a variety of reasons, resources, time, and then their preferences. So we know that at the end of the day, people could have the most, perfectly designed randomized controlled trial, but there's always uncertainty. Science is always imperfect, and we try to be very explicit about what we can and can't say. But at the end of the day, people have their preferences and their own value system, and they're going to interpret the science in their own direction. And so I think it's really important then. So the decision science hat I bring is that I think evidence is, something that can be systematically generated in a variety of different ways. But then I also try to always acknowledge that's combined with people's expertise and preferences when it comes to making a decision about what works and what works for their.
Yeah. Yeah, you kind of anticipated my next two questions. We'll get to
Ah,
those and dig.
sorry
That's
to skip
fine.
ahead.
But I'm curious, why would people view evidence as being opposed to innovation? It seems to me that you need that evidence to make sure you're on the right track, because otherwise it's not innovation, it's just a leap of faith.
Yeah, I love that you asked this. So I think part of it is that, to establish evidence to test an intervention, it takes time. Normally it takes a year or two to even kind of plan out the intervention. Then you have to start delivering it to people or organizations and such. And that takes, days, weeks, months, years sometimes. And then you need time to analyze it. So sometimes by the time you've done all that, the context in which the problem that you were trying to solve to begin with may have changed, especially when you're thinking about, trying to change organizational behavior or things like, how a health service is delivered. That's very different than trying to, deliver an individual level mental health intervention, for example. But regardless, it just takes time to test that. And what has typically happened in science is that you don't want to cause harm. So you do a really small study then where it's just a couple people. But then to be able to be more confident that it works outside of that small group of people, then you go to a larger sample size and then a larger sample size. And so you're moving from efficacy to effectiveness. And then you start moving to a different type of trial where you're like, okay, it's worked with more people and we've actually tested it outside the lab. We're testing it in the school system or in the federally qualified health center where we want this to ultimately be delivered. But maybe the research team is still really involved. Someone who's been trained by the research team or is paid by the research team is the one delivering the thing. But that's not close to the real world, and at the end of the day, someone who has only had 15 minutes to figure out this new intervention has to be the one to deliver it. So we start doing more implementation focused trials where you have someone who is in the real world and they're delivering the intervention. It's not someone from the research team delivering it. So it just takes time to go through those different
Sure.
stages of getting more and more evidence. And so I think that's then what makes some people feel as if, evidence takes too long to generate and it doesn't meet their needs. I think the other reason is that sometimes once then you do have an intervention that's considered an evidence-based intervention, there's different registries and guidelines about kind of the types of trials and things that had to have been done to develop an evidence base and different categories of how evidence-based something is that have been designed. And sometimes those then are like a very packaged intervention. Like you have to do these 12 sessions, you have to talk about these things, and they can be quite prescribed. And when people are delivering it, they feel like, oh, I'm not delivering that intervention anymore if I need to meet this client where they are in terms of they're having a crisis today. And I'm supposed to talk to them about, housing today based on this intervention, but I really need to talk to them about childcare instead. And so they're like, I need to be able to pivot. And increasingly, interventions are designed to be more malleable and person-centered and allow that pivoting. But that wasn't always the case. And so I think that's the
Yeah.
other main reason people feel there's that dichotomy between evidence and innovation.
Yeah. I guess in a way it's best exemplified in the Silicon Valley ethos. Just
Mhm.
break things. And
Yeah.
as you're breaking things, you're going to stumble on good solutions.
Mhm.
Yeah.
Yeah.
Which is
Fail fast and cheap is what one of my mentors has taught me who works
right.
in the Silicon Valley area is yes, like
Right.
and and there's increasingly trial designs that is the point of them, but they've been used in different fields and settings and they're increasingly being used. And I think that is a very exciting thing that's happening in science right now is that we're realizing we need to fail fast, cheap, and safely. Still don't want to hurt
Sure.
clients,
Right.
certainly. But there's smart ways and ethical ways to do that.
Yeah, you're less likely to hurt somebody with a chatbot, although there are ways of hurting people with a chatbot than with an intervention.
Mhm.
The symposium I referred to was about, and I'm going to quote here, the best ways of supporting research systems that generate meaningful, implementable evidence. One of the themes or best practices that emerged was that, quote, the best available data should not be the only evidence that guides decision making. And you kind of start to touch on this a little bit. We need to integrate expertise and judgment, values and preferences, and context to make good decisions. That's a lot to integrate. How do you integrate all those things in promoting good decision making?
Yeah, great question. So I think, quite concretely, I think one some of the methods that I choose, that multi-criteria decision analysis is one of them because you are asking people to make their values and preferences explicit. You quantify them, so in a way that you can then kind of quantitatively combine them across people in the group making the decision. And then we have semi-structured interventions that we do that we kind of wrap around that where it says, okay, the tool that you filled out said these were maybe the three best interventions for your context based on your evaluation of it. But here's some questions to ask yourself to kind of interpret that even further and to have a conversation with your group. So I think there are just semi-structured methods that are both, tools that people can fill out on their own, as well as group conversations that can be had. But I think really kind of a step back is that just to acknowledge, as I was mentioning earlier, that people are going to evaluate scientific evidence or, information that they see based on their own personal experiences, the way that they interpret the world, their evaluation of their local context. And we need to just meet decision makers where they are with that and be able to say, very clearly, here's the kinds of questions that we can answer with science, and here's, the evidence on this particular topic you care about, and here's where we're unclear still, because there's no such thing as a decision that's made with perfect information. There's always unknowns. And so that's also something that we think about in decision science is how do we help people think about the trade-offs that matter most to them and meet them where they are in terms of their level of uncertainty that they're willing to tolerate, their risk preferences in that sense. Those are always going to be, considerations in decision making.
How do you integrate or balance qualitative with quantitative data? Because I think that evidence usually is weighed, or at least in the general mind, it means more quantitative than it does qualitative. But I know that qualitative is an important component, particularly when we're talking about lived experience and how important that is. What's your position on that?
Yeah, certainly. And that was something we talked about in that symposium is that mixed methods research, so research that consciously integrates quantitative and qualitative work is really important. And there's different ways you can do that in terms of how much you're focusing your data collection on quantitative or on the qualitative side. In terms of if you're doing the quantitative first, maybe you're giving someone a study a quantitative measure to fill out in a survey or something, but then you could do qualitative afterwards to be like, tell me more. We're actually not quite sure how to interpret this based on, we got a lot of different responses. And so you kind of try to explain with the qualitative. Can go in the reverse as well, where you are starting out trying to understand where you want to focus your quantitative assessments and analysis. And so you talk to people first in a qualitative approach, and then you develop your study measure based on that, for example. You can also do them at the same time. So there's a lot of literature around how to do that, how to integrate the two methods. And some methods like system science and system dynamics that I use integrate them in even different ways than because of how we think about things. And I'll do one last plug kind of on that before your next question is one of the reasons I really like system dynamics and is there's a quote in there from John Sturman, one of the founders in that field, that says if we omit a variable because we can't measure it quantitatively, we assign it the only value we know to be untrue, which is zero. So just because we can't measure something doesn't mean that we shouldn't try to understand it, include it in terms of how we're trying to explain the world. And so I think, again, a really big plug for qualitative work.
Yes, and obviously it needed one. So, on behalf of qualitative work, thank you. Um, I didn't know that. Yeah, I'm appointing myself a qualitative spokesperson, at least for today.
Great, go for
I'll negotiate after this conversation.
it.
Um, anyway, tell me about the Data to Action Oregon program. What is it about? What does it involve? What's your role in it?
Oh, I'd love to. So that's a project funded by the National Institute on Drug Abuse. It's funded through the HEAL initiative, helping to end addiction long term. And that's kind of the equivalent of like the Cancer Moonshot program that maybe folks are familiar with. It's a similar focus then on trying to address the opioid epidemic in our country. Our project focuses on both opioid and stimulant use because of what we had been hearing in our communities as we were preparing the grant and knew from the data as well in terms of what people were facing and dealing with. But a bigger step back is that the initiative was already kind of focused on data to action. That was what they, NIDA funded it as, and whether I think there were 10 projects funded within this focus. And the goal was to increase data-driven decision making to address the opioid epidemic. And people, interpret that a lot of different ways in a way that's really beautiful in terms of how you can give scientists the same prompt and we all, hear it very differently, answer the call differently. But being a decision scientist, I took that very literally and wanted to take a step back and try to understand what data do decision makers even want to inform their decisions? How could how we present data actually inform the actions they could take? So for example, I always think about if we just give people, the number of overdoses that are occurred in their community in the past year, that doesn't necessarily tell them why and thus what actions to take. So the point of the project is to understand, what data points should we put together, qualitative or quantitative, to help actually provide the context that decision makers want to inform how they could take action in their communities. And that could be, a decision maker we define quite broadly in this study. So we talk about that there could be, people who deliver clinical services, and it could be a policymaker, like a county commissioner. It could be an advocate or someone who does research within those organizations to support those decision makers. So the goal of the project is to talk to people at the local level who are really doing the work day in and day out to address substance use services and supports and outcomes in Oregon. And we're trying to support 5 different types of decision makers: public health, behavioral health, first responders, payers, and advocates. And the project is testing an approach for a semi-structured approach for learning what data they care about, and then co-designing what we call data products, or ways to share that information back with them. And then we're going to be testing whether those data products actually do support their decision making, whether they like them or not. And yeah, are they useful? Does it actually impact the actions that they feel they can take? Because we had been hearing that a lot of times people feel they can't get the data they want, and that if there is a dashboard or report developed by a researcher or a state agency, that it is not very approachable, that it's not very user friendly. So that's why our study kind of is both of those parts, trying to understand what people want and then co-designing the way to give them what they want.
Yeah, it's interesting doing these podcasts, particularly with your colleagues. A number of things emerge. One of them is the degree of collaboration and
Mm,
cooperation these programs require that I think is lost in a lot of people. It's
mm.
law enforcement, they're politicians, they're business leaders, they're community leaders, they're just people from the community, volunteers.
Yes.
And you talk about consensus and how important a concept that is in this whole decision science approach. It's really all of a piece.
Oh, yes, I love that you pulled that out. Yes, I think it's just so important, and that's why we know that it takes a lot of different people to help people navigate services, to deliver the services in a community, and so we think it's really important to hear from them. And we had heard, people talking about from some of those perspectives saying, "Hey, this policy was handed down to me, and I have to now implement it, but I was never at the table when it was being designed." And someone's just basically telling me how to do my job. And so again, that's why we want to bring together as many people at the table as we can. And collaboration is actually one of the mechanisms that we're testing in this study, is how does collaboration change over time? And that's something that is really hard to measure. We could do a whole other podcast on the quantitative and qualitative ways that we're doing that.
So
But
that we already identified a topic for our second, so now we already have a third. Okay,
you're gonna
I'm
be so
just keeping
tired of
score.
talking
That's
to me.
it.
Yeah. Fighting myself back.
Yeah. Yeah, no, that'd be good. So, by the way, we already gave qualitative a plug. Is there anything else? It's early in 2025. Anything else you want to give a plug to? Any new program, anything?
Yeah, I mean, this project and the systems thinking that comes with it. I mean, I think the reason that I get really excited about system science too is I think it helps us make the assumptions that we have about the world very explicit. So the method that we used primarily is called group model building. So we have conversations with these diverse perspectives in the same room. So people from law enforcement and from payers and behavioral health and public health, to understand how do they all see the different problems. But by having these semi-structured methods, you have to kind of try to understand, oh, are we talking past each other? Do we maybe see the world similarly, but we didn't realize that we did? And are we really understanding why the problem is maybe perpetuating over time, and what the potential impacts are of the different actions we could take? And the methods, the system science methods we use, you literally diagram that out. We use cool like post-it notes and markers and software and all these different ways. But what that scientific tradition has shown since the 70s, when it really started emerging, is that it's really easy for us to not anticipate the impacts of our actions. And we have unintended consequences sometimes because we didn't understand really the problem we were trying to address to begin with. And we didn't think through all the potential implications of what we're going to do. And system science can help us do that in a better way. We think about changes over time and how everything's interconnected, that if I push something over here, where is it going to pop out differently? What else is going to
Yeah.
change, because those connections. And I think that can help us all in our daily lives to use that kind of systems thinking in terms of how is everything connected. It can help us, yeah, in our communities then as we're thinking about how to intervene, how to react to policies, how to plan policies. So yeah, systems thinking would be my other plug for the year.
Ah, okay, great. And by the way, once you have that tool ready to go and you develop the domestic version for it, it would definitely help out here at 20404 Hacienda Court. Many times we could use an objective decisioning tool to help us
Yes,
through some rough patches. So let me know, please.
I will. I'll share you a link to some of our tools. How about that?
Please. Excellent. Grayson, I'm glad I finally had a chance to talk with you. I've been trying to track you down and
I'm
get you
sorry.
to commit. You are an extraordinarily busy human being, so thank you.
Yes. Oh, it was such a pleasure, Charles. Thanks for having me.
Thanks. Really enjoyed this. Today, I was joined by Dr. Gracelyn Cruden, a research scientist at Chestnut Health Systems, Lighthouse Institute Oregon Group. Her research leveraged systems science, decision science, and implementation science to develop tools, processes, and partnerships to implement evidence-informed programs and policies. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.